Good afternoon and happy Friday. Welcome to the COVID-19 Learning Community, hosted by the COVID Command Center, powered by the Joint Information Center. For housekeeping, by default, all participants will be muted to minimize distractions. For Q&A, please use the raise hand function at the bottom of your screen. When called on, please unmute your microphone to ask your question and remute your microphone when not speaking to minimize background noise. When speaking, please announce yourself and speak slowly. You can also enter your questions or comments into the chat panel. Please hold all questions and comments until after the presentation portion of the event. Today's meeting objectives: we will review the current state of the San Francisco pandemic and local indicators of hospital capacity, disease situation, and disease control and current pop-up testing efforts. To review the update draft pretest counseling script and solicit community partner interest in helping to finalize. To review eligibility requirements and free services provided through city-run isolation and quarantine hotels. And here's today's agenda, and I pass it over to Jeffria Morris. Jeffria, the floor is yours.
Hi, good afternoon, everybody. I hope you all are staying cool with this nice, warm autumn weather we're having. Today, I know last week I said that we would have a conversation about the flu shot. And so that presentation is being postponed to later in this month. But we have a packed agenda today to talk about some different rollouts that we're doing, as well as isolation and quarantine. I also want you all know, community partners, that this will continue to be a forum for you to provide feedback as we begin to operationalize this and move a lot of this work in the community. So especially during the month of October, we will be bringing different things for asking for community feedback in a certain segment of our presentation. So I'm glad you all come every Friday. I hope this information is useful. And I would like to turn it over to Dr. Fuchs.
Well, welcome to okay. Anyways, we'll just go with it. Thank you for having us, and we're very excited to share this with you. As Jonathan said, I'm Rebecca Pfeifer-Rosenblum. I've been working with the team assessing and coordinating placement into isolation and quarantine hotel rooms since March. But in my normal job, I'm a nurse with the street medicine team, medical respite, and the sobering center.
Good afternoon, happy Friday. Thank you everyone for your time. My name is Jazmin Barrera, or Jazmin Barrera. I've been activated since April, serving as a social worker, initially at the containment branch. I was with another unit, but I've been with the REACT team since June. My home clinic is the Transitional Age Youth Clinic. I'm a behavioral health clinician there, and I serve people that experience multiple chronic conditions. And I'm happy to serve and present to the community about some of the work that we've been doing so far.
Here's our agenda. If you have any burning questions, feel free to put them in the chat, which I hope you can still see, and or just ask. But there's a good chance we'll actually get to them as we move through the slides. So you could also wait till the end when we'll have time for questions.
So this saying is a phrase in Spanish, mejor prevenir que lamentar, loosely translates to it's better to prevent than to lament. And the reason this is here is primarily to help remind us that our goal is to try to prevent the spread of COVID in our communities. And I encourage all providers that are participating in this or will see this to think about a phrase or a concept that resonates with the person or the community that you're serving. Usually this is a way to get people to engage a little bit more and really hear out more about what some of the benefits could be about isolating and quarantine. So one of the things that we wanted to just highlight to partners in the community or other folks that are trying to connect folks to our intake team is to first be your true authentic self. And it's okay to not be a medical provider when you're referring people to our team. The most important thing I think is to remember that all of the information that's about their medical history is private and remains confidential. And also thank them for being able to consider some of the feedback that we're going to share with them and guidance about how to isolate and quarantine. And another thing that for those of you that are participating and are familiar with motivational interviewing. It's a technique and a skill that I found useful in helping people figure out what their options are. And also remember, it's really critical for people to take a person-centered approach, meaning that folks have an option. They're not mandated to have to isolate or quarantine. And build on the rapport and the relationship you already have with the person that you're connecting to our team.
Also keep in mind that you may be helping people with isolation and quarantine guidance in all kinds of settings, in homes, on the street, with people around. So keep privacy in mind, make sure the person is feeling comfortable and that their privacy is respected, and move to a spot where you can have a good private area to talk if necessary. Next, we'll go over what isolation and quarantine mean and who needs them. So isolation is staying away from others to help prevent the spread of a disease that you know you have. Quarantine means staying away from others to see if you develop a disease that you've been exposed to. And both of these things can be done both in the city-sponsored hotels or at home. Some terminology here: ACC stands for asymptomatic close contact, and that's just someone who needs to quarantine because they know they've been in close contact with the person who's tested positive for COVID. A PUI stands for person under investigation. That just means someone who has symptoms of COVID, but they haven't had a test yet, or their test results aren't back yet. So as you can see, not everyone who's being recommended to stay in isolation is necessarily positive for COVID. We're cautious, and we ask people to isolate if they even might have
So
COVID.
some of the wraparound type of services that are provided and intake, and also once a person decides to go to one of the hotel sites, is the social work services and case management. There's a nurse that's also on site. Folks are able to get a discharge letter and a discharge plan so they can go back to their regular activities prior to having to come to our site. Food is also included and provided. Laundry facilities are also available on site. Folks are able to have a private room and their own bathroom. And
and also regarding the nursing support, people can dial 0 on their hotel room phone any time of day or night and reach a nurse if they have a question. They'll also receive twice daily symptom checks over the phone. The transportation, I like to let people know, is usually a van, but once in a while they send an ambulance, which I always warn people that that could happen just because it can be a little alarming if an ambulance shows up. It's not to take them to the hospital, and it doesn't mean they're sick. It's just their transportation. If folks don't have a chance to get tested before coming to the hotels, that's okay. They can get tested at the hotels. There's over-the-counter medicine at the hotels, but if people take prescription medicine, they should bring that with them.
Also, I'd like to clarify that folks that are really in need are also able to get some behavioral health support at the sites as well.
Absolutely. So the first step is actually just to assess if the person really needs to come to an isolation and quarantine hotel, or if they're okay to stay where they are. And these are some reasons that someone might stay where they are versus coming to a hotel. And first we'll go over how to refer someone to a hotel, and later we'll talk a little bit more about how to support people who are going to stay where they are. So if you're going to submit a referral to a hotel site, there's an online form that you can use called Get Care, and we'll go over how to fill that out. This first bullet point here is the link to the form. The referral will be reviewed by a nurse who will determine if the person needs the service and if it's a good fit for them. And you'll usually hear back in about 15 minutes to 2 hours at the very most, usually much less than that. You don't have to call if you're referring somebody, but this number here at the bottom, the 628-652-2820, is the phone number that will get you one of the intake nurses from 7 a.m. to 8 p.m. every day of the week. And you're welcome to call that anytime. If you have a question or you're worried about something or you're not sure you're doing something right, no problem, just call us. That's what we're here for. One thing to keep in mind is that people can't self-refer. So no one can fill out this referral form for themselves, but almost anybody else can do it. A service provider, social worker, case manager, building manager, employer. We try to make it easy. Let's see. The form is compatible with smartphones and tablets, but it is easier on a computer, and we definitely recommend using the Chrome browser if you can. It's the browser it works best on. Just to point out, some of you might have heard of the shelter-in-place hotels, which are housing for people who are vulnerable to COVID but don't necessarily have it. And we're a completely separate program with a different purpose. We're to prevent people who may be contagious with COVID from accidentally spreading it. So we're not able to help with referrals to the shelter-in-place hotel.
This section of the intake form is really important because it highlights the information of the person referring the patient to us. So this is primarily you, or whatever your role is. It's important for us to have the name and phone number for us to be able to get a hold of you in case the patient isn't available to answer any of the questions that need to be reviewed with them. So please make sure that you put at least a phone number and email address where the team can follow up with you. And this also helps to facilitate a warm handoff, going back to just if you've already established rapport with some patients or clients, and this time can be a little bit scary, feel free to put your best contact information so we can help streamline that process for them. This second section is also just as important because we need the patient or client's name and phone number at the very least. We do our best to try to get a hold of them first, just so we can coordinate the next steps in getting them connected to whether it's isolating at the site or going to their natural environment.
And this is the information we use to determine if they need to isolate or quarantine and for how long. We also use this information to consult with our medical director to make sure that they're healthy enough to stay out of the hospital or if they need a higher level of care. And here you'll see those terms again, the COVID positive, asymptomatic, confirmed contact, and person under investigation. If you're referring someone who you think the right answer is none of the above, give us a call first. There's a good chance that's wrong, but there are a few cases where that might actually be the right answer.
So this section of the intake or referral form, it really is, you don't need to be a medical provider or be trained in the medical field to be able to fill it out. It's okay to ask open-ended questions like if you have any current health conditions, heart disease, diabetes, or high blood pressure. But the most important thing for this section is for us to know if the patient is taking any current medication and do they have at least 14 days worth, because that's something that we need to coordinate for the patient if, again, if they decide to isolate and quarantine. And so feel free to just also go off of what the patient's reporting to you. You don't have to verify this prior to referring them to us. The nursing team and the medical team will be able to follow up and do their due diligence to clarify all those details.
This part just helps us understand why they need to help with isolation. Again, here, if you think the best answer is none of the above, give us a call. Sometimes it's really true that it's okay for somebody to stay where they are. People don't always realize it can be really safe to isolate at home or wherever they normally live. So this information we use to make sure that the person's going to be safe alone in a room and they understand the expectations of staying in an isolation and quarantine hotel. I always want to make sure people know the program is voluntary and thank them for what they're doing to help stop the spread of COVID in their community. But I also want to make sure they know that once they get to the hotel, they'll be asked to stay inside their room and they won't be able to leave to go to work, go to the store, go to run an errand. It's totally fine for them to step outside and get a breath of fresh air. They'll just be asked to wear a mask and stay 6 feet away from others. I also like to let people know about their meals being delivered to them. I like to let them know that a nurse will be available by phone. I let them know that they're going to get a private room with a bathroom, a bed, and a TV. There's Wi-Fi in the hotels. But I also make sure they understand that they're not going to get daily linen service. They're not going to get daily laundry. So I let folks know to pack plenty of clothing, whatever toiletries or personal items they want with them, a 2-week supply of their medication if they have it, and whatever they want for entertainment. They can bring anything they want with them, really. The only thing that's not allowed is weapons of any kind.
So this section asks some information about people's natural support system, meaning family or partner. The sites are able to accommodate single adults and families with children under the age of 18, as well as couples. The sites are also able to assist patients or individuals that need devices such as canes, walkers, and wheelchairs. And again, if you don't have all this detailed information, our team will do our due diligence to follow up with them.
So this again is just making sure people are safe inside the rooms. They need to be medically stable and they need to be able to take care of their own medical needs. For example, taking their medicine, checking their blood sugar if necessary, taking care of any wounds that they might have, that sort of thing. We do ask everybody about drug and alcohol use, and that's just to help prevent people from experiencing any withdrawal while they're in the rooms. I don't necessarily advertise this to people, but we can potentially support people with alcohol in the rooms if they need it. We can get methadone delivered to them, and we can also help with prescriptions of Suboxone for people who use opiates. And we also do harm reduction training and overdose prevention and provide Narcan.
So as I mentioned earlier, once a person decides to go to one of the sites, there's a social worker there that will support them with a discharge plan, whatever that may look like. And that's why it's important for folks to understand that they're not necessarily going to just go to a site and just be left there to recover from whatever they need to recover from. The discharge usually involves some clearance to be able to return back to work, and linkage to other community-based services that might help support the person with their stabilization and recovery.
Next, we'll talk about some common questions and concerns that people have about coming to the hotels, and then the answers and solutions that we've come up with.
So this is a list of some of the barriers towards isolation, which can get in the way of people deciding whether or not they want to quarantine or isolate. The most common one that seems to come up is people don't want to leave their family or their homes. And also for folks that are dealing with immigration issues, there's concerns about that, and also there's any financial loss or wages. Some services are provided, primarily meaning case management that's linking people or patients that need this type of service. And also, as a behavioral health clinician, sometimes I'm able to provide some emotional support to help mitigate some of that attachment that people have. But for you all who are, again, just connecting and referring patients to us, it's okay to address some of these things, and just know that on our end, we do our due diligence to try to cover some of these services and meet the community's needs.
One thing that comes up is immigration status, and just a reminder that we never ask for social security number, and their decision to stay in one of the hotels will not affect an immigration case. The hotel rooms are really truly free, and they really are voluntary from start to finish. So if someone decides to go, gets there, doesn't like it, wants to leave.
Can y'all mute everybody? We can't hear well.
Oh, can you hear me now?
Uh-oh.
Yes,
Can
we
you
can.
hear me?
Yeah, we can hear you. Thank you.
Oh, you can?
Good.
Echoing.
Yeah.
All right. Okay, you can hear?
Yes.
Okay, sorry guys. The hotels are free, they're voluntary. People can receive deliveries of food or other items from family or friends while they're staying in the hotels. Bags will not be searched. Families can stay together if that's what makes sense.
The most common and most useful ones so far. And we've now reached the end or the conclusion of our presentation and training. And I'm ending with this concept, that's a Mayan concept or phrase in Lakesh, loosely translated in Spanish, so it is mi otro yo. In English, we're interconnected, just to be mindful that we are combating this disease as a community. And again, I encourage all of you who are serving other patients in other communities from different parts of the world to think about what worldview or concept might resonate with them that can help begin that process of engaging them to consider isolating and quarantining, and knowing that we as a team, meaning them and us, not the patients and us as providers, are in this together. Thank you for your time, and feel free to share any questions, feedback, or concerns with us at this point.
Thank you.
How many rooms, how many hotels?
There's 3 hotels throughout the city, hundreds of rooms. I don't know the actual number off the top of my head.
Thank you.
Yeah.
I know, Brian, do you want to ask your question?
Sorry. Yes, please. Sorry, I was writing an email. I was distracted. Yeah, I just wanted to know if folks, if they do not have that 14-day medical supply, I can see that being, you know, a challenge for some folks, and depending on what the meds is. And is there any help they can get so that they can get in the INQ room as quickly as possible with that 14-day supply?
Absolutely, yes. We can organize refills for them delivered to the hotel rooms. We just like to know right away so we can make sure we get that process started.
Awesome. Thank you.
Yeah.
I know it has come to my attention about the food provided during isolation and quarantine not being culturally specific. And like, I know like members of the Asian community receiving bags with high dairy content that's not a part of their normal diet. So can you guys talk more about making meals more culturally responsive?
Well, I can't speak for what the feeding unit provides, but what I know I try to do is in the feeding unit referral, I'll let them know any dietary restrictions. Folks have been comfortable when I've had the time to do the referral to let me know their preference. And I let them know that's not guaranteed. In terms of what's provided at the sites and at the hotels, I'm not too sure how that's coordinated, but I'll defer to Rebecca to see if she can give any feedback about that.
Yeah, I know this has been a huge problem since the very beginning. And I know there's been a lot of conversations with leadership and the emergency operations center feeding unit around that. And it seems that it's not changed much. So we are pretty upfront with people from the start that the food that they get at the hotels might not be the food that they're used to eating. We apologize for that, and we remind people that they can receive deliveries from family and friends if they are able to, and they can also bring food from home if they want to. But yeah, we do recognize that's a problem.
In some cases, the rooms have microwaves.
Yeah.
So the issues of refrigeration, I believe. So tortillas, for example, sometimes can last up to 14 days without being refrigerated. It just depends. But going back to how we let people know it's not immediate. If people decide that they want to come to our site, we try to do the best we can to help them get everything in order before they get transported over to one of the hotels.
Thank you. Thank you. Is there any other questions? And I know like that was brought to my attention, and I had kind of assigned it to somebody else. So now I know I will be working super hard to try to find a solution for that next week.
Sorry, regarding this question from Jonathan Fuchs, we initially did try to support people with incentives at the end of their isolation and quarantine stay, but I don't know exactly what happened. It never ended up happening. There were logistical problems with that. And so no, the stay in the isolation and quarantine hotels is not incentivized. Any other questions?
How long will the program run for?
That's a good question. I think as long as needed. There's no specific end date.
Rebecca and Jasmine, I know we're working together about rolling out some kind of community training. Can you all kind of give the community a little bit of information on that?
Yes, well, sort of. And actually, I see one more question before I get to that, which is where are the hotels and how is it decided where people are placed? That's a really good question. The hotels are in One's in the Mission, one's in sort of Chinatown area, and one is in like kind of Tenderloin-ish area. And each one has sort of different capabilities. For example, there's one where the setup of the rooms is really good for families, so we tend to send families there. There's one that can accept methadone deliveries more easily, so we send people on methadone there. There's one that cannot accept smokers, so people who smoke cigarettes can't go there. There's a few different factors that go into determining which spot is going to be the best fit for somebody. If it's someone who really doesn't have any needs like that, then we can just sort of give them an idea of where the hotels are and let them choose which one works best for them. And then as far as future trainings, we don't know the dates of the next trainings yet, but we are ready to go and happy to do this.
If
Yeah.
I may add, I think in terms of how the decision has been made where folks are placed, when folks are high functioning, basically, for lack of a better word, it's a collaborative process. A person might have other factors involved, and the nursing team will accommodate them as much as possible in placing them at the best site. And in terms of the community-based trainings that we're trying to start piloting in the city, is my understanding is there might be a second part where I go into more depth about how the social needs assessment is conducted, and that might include the full list of the resources that have been used. Also, I understand that it's more to help, you know, a lot of peer outreach workers or other people that haven't been as accustomed to responding immediately to COVID to get more comfortable, right? And streamlining this and really creating a partnership with the community. And so this presentation is a beginning, right? It's kind of launching us off in that direction. And the way I understand it, and I'm hoping it'll go, is to continue having a conversation, right? Sharing information, a lot of information sharing, but this is how we're trying to do this. And one of the things that I hope it's not implied, but we as a team are intentional about being culturally congruent. We've had a lot of folks from different communities come up, and we've done what we can to try to get people from within our system to try to help streamline that service, specifically for the Mayan community. And so things are in the pipeline, and we know that there's a lot of work ahead of us, but we also understand that the community is in a place where they can pick up some of this work. The resources that I'm sharing come from the community, really. And so I don't know if that helps to address some of that, Jeffrey. But thank you again for your time and for this platform. Thank you, everyone.
Thank you all. I don't see any other hands up or anything in the chat. So I want to thank you both for, this is amazing. And your slides will be available for us to send it out to everybody on our email list.
Yeah.
Thank you. I'm giving you all a round of applause. I'm gonna open up my screen.
Thank you.
Thank you.
Thank
Giving you
and
a round of applause.
Just one other comment, Jeffrey, that I was just going to make. So again, and Jasmine and Rebecca, thank you so much for your time and for putting together a great presentation. And so the upcoming sessions that are going to be scheduled, if people recognize that a number of people may have staff who would like to be able to make referrals to INQ hotels who weren't able to participate in today's session, the goal is to have an hour-long training session, and there will be a couple of sessions. One will be in English, one will be conducted in Spanish, and there will be additional trainings that will be conducted in the future, but those will be recorded as well. And we're still working out the details of where those recorded sessions will be stored for future reference. But if you have specific requests or a timing of when those trainings should be conducted, like what day of the week or timing during the day, please just shoot that in the chat. That will be helpful, and we'll kind of pull all of those requests and then get those scheduled as soon as possible.
Yeah, and I also want to say that I know we forgot to say Chinese. That too will be in the pipeline, but getting the Spanish one out and the English one is the top priority right now. And then we will get to Chinese. It will not be like that far behind, but we know 50% of the new cases are Latinx. So we are trying to push this out as fast as possible. Oh, we are in there. Thank you, Calvin. So yeah, so I just wanted to make sure.
Nice. Great.
Thank you. And I just give a shout out to my daughter, Delilah Martinez, did the graphics for us. She likes to try to use her talent and work to promote social justice and address some of the social determinants to help, right? And so my baby girl, she's third generation from the mission. So again, thank you for this opportunity for both of us to present and collaborate as a family. Thank you. Mil veces gracias. Thank you.
Beautiful. Thank you.
Thank you. I love that San Francisco native. I'm a second generation. With that being said, we're giving everyone 5 minutes back into your life. Enjoy. This will be recorded. And like I said, I will be working with the HRC to kind of have this stuff live and really promote our past meetings as well as those going forward. I know next week, when we have our debrief after this, I will be looking to have our food insecurity unit to possibly do a presentation. As we just seen, it's a big problem regarding culturally specific food. And thank you all. Enjoy your 4 minutes now.
Thank you.
Thanks so much.
Thank you for joining the COVID-19 learning community. If you have any questions or needs, please contact equity-neighborhoods@sfgov.org. Thank you.